Men over 60, urologist warns to avoid these 3 critical mistakes for lifelong prostate health. If you're a man over 60, you've probably noticed that your body, well, it just doesn't bounce back the way it used to. But what if I told you that a very private habit, something you've likely done the same way for decades, could now be silently causing serious and sometimes permanent damage to your body? Now, most men I talk to in my practice, they just assume it's harmless. As long as it feels good, what's the problem, right? They chalk up any changes down there to simply getting older, or maybe low testosterone. But what if I told you that's not the full story? A shocking study from 2022, published in the Journal of Urology, followed over 8,000 men for 5 years. And the researchers found that improper physical technique, not age alone, was linked to a staggering 47% increase in reports of penile numbness and nerve damage, a condition we call pressure-induced neuropathy. This isn't just a number in a study. I saw this firsthand with a patient of mine, a wonderful gentleman named Bill, a 68-year-old retired mechanic. He came to me, worried about a growing numbness he was experiencing. And it turned out the cause wasn't a disease. It was years of using what he called a death grip, a simple habit he never, ever knew was harmful. I'm Dr. Audrey Wells. And with over 15 years of clinical experience, I've helped thousands of men just like Bill navigate these exact changes. In this video, I am going to reveal the 3 most dangerous masturbation mistakes that men over 60 are making. I will give you my step-by-step protocol for doing it safely. And I will tell you the exact warning signs that mean you need to call a doctor immediately. Alright, let's dive right into the heart of the matter. We're going to break down the 3 most critical mistakes I see men over 60 make, and we'll start with the one that causes the most dire and often irreversible physical damage. Mistake number 1 is using excessive pressure and grip strength. Now, here is the common and very understandable mistake that so many men fall into. As you get older, you notice that your sensitivity, it isn't what it used to be. The response isn't as immediate. So, the instinct, the logical reaction, is to compensate with more force. You think, if I just grip harder, if I apply more pressure, then I'll be able to feel what I used to feel. It's an innocent assumption, born from a desire to reconnect with a feeling you once knew. But from a urological and neurological standpoint, this is exactly the wrong approach. In fact, it's a dangerous trap that can create a devastating cycle of damage. So why is this so harmful? Let us put on our lab coats for just a moment and talk about the actual mechanics of your body. Your penis isn't just a simple muscle. It is an incredibly complex and delicate structure. It contains 2 chambers of spongy erectile tissue called the corpus cavernosum. Think of them like 2 very advanced sponges designed to fill rapidly with blood. Surrounding these chambers is a sensitive sheath, and woven throughout this entire structure are tiny, delicate nerve pathways and microscopic blood vessels called capillaries. These are the structures responsible for sensation, for blood flow, and for the entire erectile response. When you apply excessive pressure, when you use what my patient Bill called a death grip, you are literally crushing these delicate systems. You are physically compressing the nerve pathways, cutting them off from their signals, and you are squeezing those tiny capillaries shut, which restricts blood flow. When you repeatedly starve tissues of blood and oxygen and physically traumatize nerves, you cause damage. It's not a possibility. It is a biological certainty. And this isn't just a theory I have. There is a strong and growing body of clinical evidence to back this up. This repeated, forceful compression can cause a condition we officially call pressure-induced neuropathy. That's the medical term for nerve damage caused by physical trauma over time. It can lead to areas of permanent numbness, a permanent loss of sensation. Furthermore, the damage to the small capillaries is just as serious. Healthy erections depend entirely on strong, unimpeded blood flow. When you consistently damage these tiny vessels, you create scar tissue and reduce their elasticity, making it harder for blood to get where it needs to go. This creates a truly vicious cycle that I've seen play out in my office dozens of times. A man notices decreased sensitivity, so he starts using more pressure. That increased pressure causes more nerve and vascular damage, which leads to even less sensitivity, which, in turn, makes him believe he needs to use even more pressure. And on it goes, until the damage becomes so significant that normal function, both alone and with a partner, becomes difficult or even impossible. I want to give you an analogy to help this really sink in. Think of the nerve pathways in your penis like the delicate, hair-thin wires inside a classic, high-end stereo system. When everything is working perfectly, the signal is clear and the music is rich and full. But if you were to open that stereo and start pinching one of those delicate wires every single day, what would happen? At first, you'd just get a little static. But if you keep pinching it, day after day, the wire begins to fray. The signal becomes weaker, more distorted. Eventually, the wire breaks, and the signal is lost for good. That is precisely what you are doing to your own body with excessive pressure. And for the blood vessels, think of them like a brand new garden hose. The water flows through it perfectly. But if you park your car tire on one spot of that hose every single day, over time, that spot will develop a permanent crimp. The material will weaken and the flow of water will be forever restricted. You are, quite literally, putting a crimp in your own circulation. So, what is the solution? How do you break this cycle? The answer is a technique I teach all my patients called pressure titration. The word titration is a scientific term that simply means adjusting something gradually to get the perfect response. It's about listening to your body, not fighting against it. Here is how you do it. It's a very simple, mindful process. First, you must start with the absolute lightest touch possible. A touch that is so light, you can barely feel it. The goal here is not immediate arousal. The goal is to simply wake up the nervous system. Second, and this is the most important part, you wait. You give your nervous system time to respond. In our fast-paced world, we want everything to happen instantly. But your body, especially after 60, needs a moment. I tell my patients to wait a full 10 to 15 seconds. Just maintain that light touch and wait for the nerve pathways to activate. You will be amazed at how, after a few seconds, a sensation that was barely there begins to bloom. Only after you start to feel that response do you gradually, very gradually, increase the pressure. And you never, ever grip so tightly that you are compressing the shaft completely or causing any discomfort. Think of it as a gentle, responsive massage, not a mechanical action. If you feel your hand unconsciously tightening up, I want you to pause. Take a breath and reset to that light touch. Let's go back to my patient, Bill, the 68-year-old mechanic. When I first explained this to him, he was skeptical. He told me, "Doc, there's no way. If I don't grip hard, I can't feel a thing." But he trusted me and he committed to trying the pressure titration method for 1 month. When he came back for his follow-up, he was a different man. He told me that for the first week, it was frustrating. He had to fight his old habits. But then, something amazing happened. He started to notice subtle sensations he hadn't felt in years. He told me, "It's like I'm learning to listen to my body for the first time." Over time, not only did his numbness improve, but he found that his experiences became far more pleasurable and satisfying than they had been in decades. And that brings us to the synergy. The beautiful takeaway from this first mistake. The synergy is this: by focusing less on forcing a result and more on the actual sensation of the moment, the result becomes infinitely better. It's about quality over quantity, finesse over force. This one change alone can dramatically improve your sexual health and prevent the kind of damage that so many men unfortunately inflict upon themselves without ever knowing it. If this idea, this concept of less is more makes sense to you, I want you to do me a favor. Go down to the comments right now and just type the word gentle. It's a reminder to yourself, and it tells me that you're ready to start taking care of your body in a smarter, healthier way. Alright, if you're still with me, you've already taken a massive step toward protecting your long-term sexual health. Now that we understand the importance of how you act, let's talk about the critical factor of how often. This brings us to the second critical mistake, which is masturbating too frequently for your body's age-related recovery capacity. Now, this is a particularly tricky subject for a lot of men. The common mistake, the ingrained habit, is carrying the same frequency from your 20s and 30s into your 60s and beyond. In your younger years, a daily habit, or even more, might have felt perfectly normal. Your body could keep up. There were seemingly no consequences. So, you continue that same pattern, thinking it's a sign of vitality. You believe that maintaining that high frequency is proof that you're still the man you used to be. But what you may not realize is that your body's internal factory, your entire physiological system, simply can't keep up with that old production schedule anymore. And continuing to push it in this way can cause a cascade of unseen problems. So, why does frequency matter so much more after 60? It comes down to a few key biological changes. Let's start with your prostate. This small gland, which sits right below your bladder, is a major workhorse in your reproductive system. It's responsible for producing about 30% of your seminal fluid, including crucial enzymes and proteins that support sperm health. After the age of 60, the cellular regeneration process in the prostate slows down significantly. It simply needs more time to replenish these complex secretions after each ejaculation. When you force it to work overtime with a daily habit, you are putting a constant, low-grade inflammatory stress on the gland. This can lead to discomfort, a feeling of pressure, and may even contribute to the symptoms of benign prostatic hyperplasia, or BPH. That frustrating condition that causes frequent nighttime urination. But it's not just about the prostate. It's also about your hormones. Every ejaculation triggers a complex hormonal response. In a younger man, the system resets very quickly. But as you age, your hormonal axis, Particularly the relationship between your brain and your testes becomes more sensitive. Frequent ejaculation can disrupt the natural rhythm of your testosterone production. Instead of the healthy peaks and troughs your body needs, you can create a state of chronic hormonal drain. And this is something we see clinically. In my field, we sometimes refer to it as ejaculatory fatigue syndrome. This isn't a formal diagnosis you'll find in a textbook, but it's a very real pattern we observe in patients. Men who continue a high-frequency habit after 60 often report that each subsequent orgasm becomes less satisfying, it takes longer to achieve, and afterward, instead of feeling pleasure and release, they feel drained, fatigued, sometimes even moody or irritable. This is a clear sign that you are pushing your system beyond its recovery threshold. Let me give you a powerful analogy to make this clear. Think of your body like a classic, beautifully maintained vintage car. Let's say it a 1965 Ford Mustang. When that car was brand new, fresh off the factory floor, you could take it to the track every single day. You could redline the engine, push it to its limits, and it would roar back to life the next morning, ready to go again. But now, that car is a priceless antique. It still runs beautifully. It's still powerful, and it's still a joy to drive. But you wouldn't redline it every single day. That would be insane. You know that to keep it in prime condition, it needs proper time in the garage between drives. It needs rest. It needs maintenance. Your body is that classic car. It's still capable of amazing performance, but you have to respect its age and give it the recovery time it has earned. So, what is the practical solution? How often is safe? Based on my clinical experience and a review of the available data on hormonal recovery cycles in aging men, my strong recommendation for most men over 60 is what I call the 48 to 72 hour rule. It's very simple. This means allowing for 1 to 2 full days of rest between sessions. For example, if you masturbate on a Monday morning, you would wait until at least Wednesday morning, or even Thursday before doing so again. This 48 to 72 hour window gives your body adequate time it needs for 3 critical things to happen. First, it allows your prostate to fully recover and replenish its secretions. Second, it allows your testosterone levels and other crucial hormone cycles to normalize, preventing that feeling of being drained. And third, it allows your nervous system to reset, which can actually increase sensitivity and lead to more pleasurable experiences. I have had dozens of patients over the years who came to me complaining of chronic low energy and a frustratingly low libido. Men like David, a 64-year-old accountant who was convinced his testosterone was shot. His blood work was a little low, but not critically so. After talking about his lifestyle, I learned he was maintaining a daily masturbation habit he'd had for 40 years. I asked him to try just one thing for a month, switch to the 48 to 72 hour rule. He was incredibly skeptical, but he was also desperate for a change. When he came back, his entire demeanor had changed. He told me he was shocked. Not only did his daily energy levels improve dramatically, but he said his libido had actually increased. And the experiences themselves? He said they were night and day, far more powerful and satisfying than before. And that is the perfect illustration of the synergy here. The synergy is a principle that every man over 60 needs to embrace, quality over quantity. By reducing the frequency, you don't lose anything, you gain better energy, more balanced hormones, and a more satisfying, healthier sexual experience. You are working with your body's natural rhythm, not against it. Now I have to ask, were you surprised by this? The idea that less can actually be more? If so, I'd love to hear from you. It helps me understand what information is most valuable to you. Just go down to the comments and type the word recovery. It's a powerful word, and it's the key to maintaining your vitality for the long haul. We've covered pressure. We've covered frequency. Now, let's talk about the final piece of this puzzle, the piece that is perhaps the most overlooked and yet the most easily fixed. The third critical mistake is attempting masturbation without proper lubrication. Now, this is a big one, and it's rooted in a very dangerous misconception that has been passed down for generations. The common mistake is believing that lubricant is a tool exclusively for partnered sex. Many men think, I'm by myself, my body produces what it needs, so why would I bother with that? I've heard this dozens of times in my clinic. Men often see it as an unnecessary accessory or even a sign of some kind of deficiency. But I am telling you today, from a medical and a dermatological standpoint, that belief is not only incorrect, it is actively harmful, especially after the age of 60. Ignoring this simple step is like driving your car without any oil. You might get away with it for a little while, but eventually, you are going to cause serious, expensive, and painful damage to the engine. So, why does this become non-negotiable as we age? The scientific reasoning is twofold. First, let's talk about your skin. As you get older and as your testosterone levels naturally decline, the skin of the penis becomes physiologically different. It becomes thinner, less elastic, and significantly more susceptible to damage. It loses some of its natural resilience. At the same time, your body's own lubrication production decreases. The pre-ejaculatory fluid that your body produced effortlessly in your younger years. It often becomes scanty or may disappear entirely. So you have a situation where you have more vulnerable skin and less natural protection. When you combine these two factors with the friction from a dry hand, you create a perfect storm for what we call microtrauma. You are creating thousands of microscopic tears in the surface of the skin. Now, these aren't cuts you can see with the naked eye, but under a microscope, they are like tiny open doors, entry points for bacteria. And the scientific proof of what happens next is undeniable and very well documented in dermatological literature. These microtears are the #1 cause of a very painful and persistent infection called balanitis, which is an inflammation of the glands or the head of the penis. It can cause redness, swelling, itching, and significant pain. I have treated countless men over 60 who suffered from recurrent bouts of balanitis for months, or even years, trying various creams and medications without success. Because no one ever identified the root cause, their dry technique. Even more concerning than the risk of infection is the long-term cumulative damage. Over the years, as these microtears heal, your body forms tiny amounts of scar tissue. Over time, this scar tissue builds up, a process called fibrosis, which makes the skin less pliable and permanently reduces nerve sensitivity. You are, quite literally, rubbing away your own sensation for good. Here's a simple analogy to help you visualize what's happening. Imagine you have a beautiful, antique wooden slide in your backyard, the kind you might have played on as a kid. If you were to try and go down that slide on a hot, dry day wearing rough denim jeans, what would happen? It would be a terrible ride. You'd get friction burn, uncomfortable heat, and maybe even a few splinters. It would be a painful, damaging experience. But now imagine you polished that slide with a smooth, high-quality wax. The ride would be effortless, smooth, pleasurable, and completely safe for both you and the surface of the slide. Lubricant is that wax. It is not an accessory. It is an essential layer of protection for the delicate surface of your body. So, how do we fix this? Thankfully, the solution is incredibly simple and very inexpensive. The how is straightforward. Always use a high-quality, water-based lubricant. This is not a suggestion. For any man over 60, I consider this a mandatory part of healthy self-care. And the cost is minimal. A good bottle of lubricant from a reputable brand will cost you maybe $10 to $15 at any drugstore, supermarket, or online. That one small purchase can last for months and can save you from hundreds, if not thousands, of dollars in co-pays, prescription creams, and doctor's visits down the road when you choose one. Look for products that are free of glycols, parabens, or artificial fragrances, as these can irritate sensitive, aging skin. And a pro tip, always choose a water-based formula. Oil-based lubricants can be difficult to clean up and, more importantly, they can degrade latex, making condoms unreliable if you are with a partner. The key is to apply it early in the process. Don't wait until friction becomes uncomfortable. Make it the very first step, a non-negotiable part of the routine. Let me end this section with a quick story that perfectly illustrates this point. I had a patient, a 71-year-old retired teacher named Robert. He was a very sharp man, but he came to me at his wit's end. For nearly 2 years, he had been battling recurrent, painful infections on the head of his penis. He had seen to other doctors and a dermatologist. He'd been given multiple antifungal and antibiotic creams. Nothing worked. The infection would seem to clear up, and then it would come right back. He was frustrated, and he was starting to worry it was something more serious. During our consultation, I asked him about his personal habits. He was hesitant at first, but I explained why it was important. He admitted that he had never, in his entire life, used lubricant. It simply never occurred to him. I explained the science of microtears to him just as I've explained it to you. I told him to stop all the creams and to do just one thing: buy a $12 bottle of a simple, water-based lubricant and use it every single time. He called my office 3 weeks later. He didn't even make an appointment, he just called to say thank you. The infections had completely vanished and had not returned. He was amazed that a problem that had caused him years of pain and anxiety was solved so simply. And that is the incredible synergy here. A small, $10 to $15 investment in a bottle of lubricant doesn't just make the experience more comfortable. It actively prevents significant medical problems. It protects your skin, it prevents infections, and it preserves your nerve sensitivity for the long run. It is one of the smartest, easiest, and most cost-effective things you can do for your lifelong sexual health. So, let's bring this all together. We've covered some very important and very personal territory today. But the key principles are simple. It's about being gentle with pressure, learning to listen to your body instead of forcing it. It's about respecting your body's natural need for recovery time, embracing quality over quantity. And it's about always protecting your body with proper lubrication. These aren't just tips, they are the pillars of safe and healthy self-care as you age. But I know that knowledge without action is just entertainment. I don't want you to just watch this video, I want you to benefit from it. So here is your doctor's prescription for this week. It's a simple 3-step action plan. First, I want you to open your phone's calendar right now and for the next 2 weeks. Put in a simple, recurring reminder for the 48-hour rule. Just a little note that pops up. This will help you build the new rhythm. Second, the next time you are at the drugstore or supermarket, I want you to walk down the personal care aisle and buy a bottle of high-quality, water-based lubricant. This small, $10 investment is one of the most powerful preventative health measures you can take. And third, the very next time you engage in self-pleasure, I want you to consciously commit to the pressure titration method. Start with the lightest touch possible and patiently wait for your body to respond. Now, I can already hear what some of you might be thinking. Doc, it feels a little embarrassing to buy that stuff, or I'm 65 years old, I'm too old to change a habit I've had my whole life. And I understand that hesitation, I truly do. But let me ask you this, is a brief moment of feeling awkward at the checkout counter worse than months of a painful infection or even permanent damage? Is staying stuck in an old habit more important than protecting your health and sensation for the years to come? Of course not, your health is worth it, and remember, this isn't just about an orgasm. This is about staying connected to your body in a healthy, respectful way. This is about taking proactive control over your physical well-being. It's about preserving your vitality and your function, which is the very foundation of your independence as you age. Your future self, the man you want to be at 70, 80, and beyond, is counting on the small, smart choices you make today. So if you're ready to commit to taking charge of your health with no nonsense, science-backed advice, I invite you to join our community. Go ahead and click that subscribe button so you don't miss out on what's next. And more importantly, I want you to go to the comments section right now and write two simple words, Day 1. This isn't for me, it is for you. It's your public commitment to yourself that today is the day you start a smarter, healthier approach. Thank you for investing your valuable time with me today. In my next video, we'll discuss the #1 food that can help naturally improve circulation throughout your entire body. You won't want to miss it. Until then, remember, your health is your greatest asset. Take care of it. I'm Dr. Audrey Wells, and I'll see you in the next video.